Gentlemen, let me start with a simple question. Have you ever noticed how much attention men give to a woman's breasts with their eyes? But when it comes to actually touching them, everything suddenly becomes rushed, awkward, or over in seconds. Most men don't realize this, but that moment right there is where intimacy either deepens or quietly falls flat. Because breasts aren't just visual, they're emotional, they're sensitive, they're deeply connected to trust, safety, and arousal in ways most men were never taught. And when breast touch is done with patience, intention, and awareness, it can become one of the most powerful pathways to pleasure and connection a couple can experience, sometimes even leading to orgasm on its own for some women. Today, I'm going to walk you through 9 respectful, evidence-based, and emotionally intelligent ways to touch her breasts so you don't just do something, but actually create an experience that makes her feel desired, safe, and deeply connected to you. Before we go any further, if you value your health, your confidence, and your relationships, do me a quick favor. Hit the like button, subscribe to the channel, and in the comments, tell me where you're watching from. I love seeing men from all over the world learning, growing, and showing up better in their relationships. Here's the myth I want to clear up right away. Most men were taught that breasts are mainly for visual attraction, that women don't really feel that much there. That couldn't be further from the truth. Biologically, the breast, especially the nipple and areola complex, is packed with nerve endings. In some women, stimulation here activates the same brain regions involved in genital arousal. Emotionally, breasts are deeply tied to vulnerability, nurturing, and feeling chosen, not just touched. And practically, when a woman feels rushed, grabbed, or handled without care, her nervous system doesn't open, it closes. But when she feels seen, held, and attuned to her body, responds in ways that surprise even her. Breast touch isn't about technique alone, it's about how safe her body feels in your hands. I'm Dr. Sophia. I'm a urologist and men's health specialist, and for over 12 years, I've worked closely with men and couples navigating intimacy, confidence, and connection at every stage of life. I've seen what happens when men rush, guess, or perform, and I've seen what happens when men slow down, listen, and lead with presence. Women notice the difference instantly, not because one man is better, but because one man makes her nervous system feel safe enough to respond. So, let's talk about how to do this, right? Tip number 1, start with consent and curiosity. Nothing creates arousal faster than safety. Instead of guessing or assuming, try something surprisingly simple. How do you like your breast touched? That one question does 3 powerful things. It lowers pressure. It builds trust. It gives you a roadmap. Biologically, this reduces stress hormones. Emotionally, it makes her feel respected. Practically, it prevents confusion and missteps. Some couples even use a simple system. Green means yes, yellow means slow, red means stop. It turns exploration into teamwork instead of performance. Tip number 2, slow down and start wide. This is where most men unintentionally sabotage the moment. They go straight for the nipples. Too fast, too soon. Instead, start around the breasts, upper chest, collarbone, sides of the ribs, the gentle curve where breast meets torso. Why this matters? The nervous system doesn't jump from neutral to aroused instantly. When you move slowly and broadly, you allow her body to shift from guarded to receptive. Emotionally, this feels attentive. Physically, it increases sensitivity. Practically, it prevents overstimulation. Think warming the room, not flipping a switch. Tip number 3, hold with intention, not a pinch. Most men squeeze. Very few actually hold. Instead of poking or grabbing, use your whole hand to cradle the breast, supporting its weight. Alternate gentle pressure with stillness. Biologically, this kind of contact increases oxytocin, the bonding hormone. Emotionally, it communicates confidence and care. Practically, it feels grounding instead of invasive. Watch her cues. Slower breathing, leaning into you, soft sounds. Her body will tell you when you're doing it right. Tip number 4, the areola matters more than you think. The areola, the darker skin surrounding the nipple, is often just as sensitive, sometimes more. Try slow circles, gentle spirals that approach, then retreat. This creates anticipation instead of overload. Emotionally, teasing builds excitement. Biologically, it heightens nerve responsiveness. Practically, it prevents discomfort. Support the tissue underneath so nothing feels pulled or strained. Tip number 5, think dimmer switch, not light switch. The nipple is powerful, but only when approached with patience. Start with feather light contact. Gradually increase only if her body welcomes it. Avoid sudden movements or sharp pressure unless she specifically asks. Biologically, gradual stimulation allows arousal to build without triggering discomfort. Emotionally, it feels attentive. Practically, it keeps the experience pleasurable instead of overwhelming. Slow almost always wins. Tip number 6, use your mouth thoughtfully. If she enjoys oral stimulation, begin with warmth, not intensity. Start with breath, then gentle contact around the areola. Only later move closer if invited. Emotionally, this feels intimate and intentional. Biologically, warmth increases blood flow. Practically, it avoids overstimulation. When in doubt, softer is safer. Tip number 7, let your voice and breath do some of the work. Touch alone is powerful, but presence amplifies it. A calm voice, short check-ins matching her breathing. These signals tell her nervous system, you're safe here. Emotionally, this deepens trust. Biologically, it promotes relaxation and arousal. Practically, it keeps you connected instead of distracted. You don't need fancy words, just sincerity. Tip number 8, pair breast touch with what works for her. Here's an important truth many men don't hear enough. For most women, consistent external stimulation is key to climax. Breast play enhances but doesn't replace that. When paired thoughtfully, the combination can be powerful. Change only one thing at a time. Let her brain focus. Let her body respond. This isn't about doing more. It's about doing things together. Tip number 9, temperature and tools only with enthusiastic consent. Yes, some couples enjoy gentle contrast, warmth, coolness, novelty. If you explore, start slowly. Keep sessions brief. Stop immediately if anything feels uncomfortable. This isn't required. It's optional and only when trust and communication are strong. Respect always comes first. Here's what I want you to remember. Talk first. Start wide. Move slowly. Support. Don't squeeze. Read her cues. Lay your touch. Breath and presence. And afterward, don't rush away. That quiet moment after, many women say it's the most meaningful part. Gentlemen, this is not about tricks. It's about attention. Some days she'll want this, some days she won't. That's normal. Respect builds desire. Patience builds trust. Presence builds intimacy. And those things compound over time. Let me leave you with this. Age does not limit intimacy. If anything, maturity gives you something younger men often lack. Patience, awareness, and confidence. You don't need to perform. You need to connect. Start slow. Stay curious. Lead with care. And you'll not only deepen her pleasure, you'll strengthen the bond that keeps relationships alive. If this video helped you, like it, subscribe, and share it with someone who might need encouragement. And tell me in the comments which tip are you going to try first. This is Dr. Sophia reminding you your best years of connection, confidence, and intimacy are still ahead. Stay strong, stay kind, and I'll see you in the next.